Dr. RJ Bruno, and I'm here today to talk about non-invasive Brazilian butt lift, or BBL. So the BBL shapes the bottom, and in some cases, if somebody has the area which is kind of droopy. You can use techniques to try to make this area more shapely. Now, if you go to a plastic surgeon, what the plastic surgeon is going to do is he's going to use his liposuction catheter to remove fat in certain areas and then place the fat in other areas to try to mold the area into the shape that's desired. This is a perfectly good technique, but once again, there's some considerations with any kind of surgery. Because this is cosmetic surgery, their insurance company is most likely not going to pay for this. They're going to say it's a cosmetic procedure and not a necessary procedure. Also, with any surgery, there's a risk of scar tissue. So you could wind up having scar tissue back there. You could also have bleeding, and you could also have infection in this area. If any of those things occur, you got an area that starts out maybe that is looking okay, but it's just not the shape that you're looking for, and you wind up in an area that's all scarred up, infected, and you may even need to have surgery done to take care of this problem, to remove the bleeding, to remove the infection. So it can be a pretty bad complication. In non-invasive therapy to shape the bottom, there are techniques that are used to mold and shape this area and to give it a better appearance. And because they're non-invasive, they don't, cause as much of complication. One of the techniques that's available is a vacuum technique, where a vacuum is applied to this area, and this causes the tissue to be moved into the area. So by using this, you can shape the area. There are some other techniques that sometimes can be used. I know some people use cryotherapy or freezing techniques. That's also an area that you can do, but sometimes cryotherapy also has complications. There is a complication which can be very unattractive, which is where the cryotherapy actually stimulates the growth of fat cells. It's kind of a alternate complication. Usually the fat cells are removed, but in this case, the fat cells actually get bigger and more common, so that the same area that you're trying to maybe reduce in size or to shape has this excessive fat accumulation, not so attractive now. So some of the other non-invasive techniques are probably better because the complications may be less. I mentioned that my friend Melissa Quinones does a body sculpting for this area, so that you have a bottom that you want shaped. She can use her techniques to give you a better shape to the bottom. I have a link to Melissa's Instagram page on my Facebook page. I'll also try to leave a link with this video so that you can check it out, talk with the therapist about whether you qualify. And also, of course, because I'm a doctor, you can always discuss this with your primary care doctor. Okay, take care.